The toothpaste market in the United States is living through a crisis that no one wants to acknowledge. While you think you're protecting your teeth at the supermarket, dozens of brands are deliberately deceiving you with massive industrial processes, putting excessive fluoride in your body, destroying tooth enamel with aggressive chemicals, using ingredients that cause gum inflammation and neurological damage. In 2025, you could be brushing your teeth with toothpaste that is actually a mixture of industrial poison and chemicals that destroys the health of your teeth and your body slowly. Most Americans don't know about the terrible quality of the toothpaste they're using every single day. In this video, you're going to learn about 6 best-selling American toothpaste brands that you should never buy. We're not talking about rumors, we're talking about laboratory analyses, toxicological studies from universities, and manufacturing practices that should be illegal. Brands that use triclosan, a chemical banned in soaps but still permitted in toothpaste. Brands that use fluoride in dangerous concentrations. Brands that add sodium lauryl sulfate that damages mouth tissue and causes canker sores. Brands that put parabens that are endocrine disruptors. If you brush your teeth in America, you need to watch this, because the toothpaste you're using could be poisoning your body day after day, week after week. It's time to know the truth about what's really going into your mouth. Colgate Total. Colgate Total is the dominant toothpaste brand in the United States. You see it everywhere. Reliable blue tube, familiar logo, reasonable price. Appears to be quality. But Colgate Total is a fraud when it comes to oral health. Scientific studies show that Colgate Total users have 5 times more triclosan in their urine than people who don't use the brand. 5 times. This means you're absorbing triclosan massively when you brush. Colgate Total contains triclosan, a chemical that was banned in soaps by the FDA in 2016 because it is an endocrine disruptor. An endocrine disruptor is a substance that mimics hormones in your body and destroys your hormonal system. Triclosan interferes with your hormone production, causes reproductive problems, causes hair loss, causes weight gain, causes metabolic problems. But because triclosan is in toothpaste, not in soaps, the FDA allowed Colgate Total to keep selling with triclosan. It's a deliberate legal loophole. Colgate Total also contains fluoride in high concentration. Fluoride accumulates in your bones, affects your thyroid gland. Studies show that populations with chronic exposure to excessive fluoride have increased risk of neurological problems. Harvard School of Public Health reported that fluoride can adversely affect cognitive development in children, causing as much as 7 points lower IQ. Children brushing with Colgate Total are being poisoned with triclosan and fluoride simultaneously. The triclosan in Colgate Total also promotes antibiotic resistance. When you use triclosan regularly, bacteria develop resistance to triclosan and to the real antibiotics you'd need if you got sick. You're creating superbacteria in your body. Colgate knows this. The brand has internal studies showing the risk, but continues selling anyway because triclosan in toothpaste is permitted. It's predatory. Avoid completely. Crest is an extremely popular American brand sold in supermarkets everywhere. White tube, marketing about professional whitening and advanced protection, reasonable price. But Crest is a multi-layered chemical fraud. Crest contains sodium lauryl sulfate, the same aggressive chemical used in industrial cleaners, in a concentration that damages mouth tissue. Crest uses SLS in quantities that cause canker sores in up to 30% of regular users, causes severe gum inflammation, causes mouth dryness, causes ulcers. SLS literally destroys the protective layer of your mouth. Once that layer is damaged, your mouth becomes vulnerable to chronic inflammation. Dentists report that long-term Crest patients develop gum recession. The gums shrink and expose tooth roots. Once the roots are exposed, your teeth become permanently vulnerable. Crest also contains sorbitol and glycerin in high concentrations that can cause chronic diarrhea if ingested regularly. And you do ingest toothpaste when you brush. Sorbitol is an alcohol sugar that feeds bad bacteria in your mouth. You're literally feeding the bacteria that cause cavities while thinking you're preventing cavities. It's intentional paradox. Crest created deliberately harmful chemistry. Crest also contains fluoride, not in excess like some brands, but combined with aggressive SLS, the fluoride penetrates more deeply into mouth cells. You're absorbing more fluoride because SLS increases absorption. Scientific studies showed that Crest users have significantly higher fluoride concentration in their bones than users of toothpaste without SLS. Avoid completely Sensodyne. Sensodyne is marketed as toothpaste for sensitive teeth, specifically for people with tooth sensitivity. Special blue tube. Marketing that appears medical and careful. But Sensodyne is pure chemical manipulation to create dependence. The brand contains fluoride in extremely high concentration, up to 5,000 ppm in some formulas, which is more than double the amount recommended by the WHO. Sensodyne puts massive fluoride combined with potassium nitrate. The fluoride progressively destroys tooth structure. The potassium nitrate numbs the nerves so you don't feel the pain. So you don't notice the damage that's happening underneath. It's complete neurological deception. You think the sensitivity disappeared when actually you just lost the ability to feel the damage. Meanwhile, the damage continues happening silently. Sensodyne creates intentional chemical dependence. When you use Sensodyne, your teeth become numb. From potassium nitrate. Without Sensodyne, the sensitivity comes back worse because now you're accustomed to the numbness. Your teeth developed chemical dependence. You're trapped, need to use Sensodyne forever, or suffer with extreme sensitivity. This is intentional manipulation. The brand causes the problem it claims to solve. The fluoride in Sensodyne, in such extremely high concentration, is massively absorbed. You're poisoning your body with fluoride. The brand specifically targets people with dental problems, people who are already worried about oral health, and poisons them with massive fluoride while pretending to help. Long-term dental fluorosis, neurological problems, bone debilitation, it's predatory. Avoid completely Aquafresh. Aquafresh is a toothpaste brand with 3 colors, white, blue, red, which supposedly represents triple protection. Cleverly deceptive visual marketing, recognizable tube in supermarkets. But Aquafresh is visual manipulation with toxic toothpaste underneath. The 3 colors don't represent 3 benefits. They represent 3 different chemicals that work together to damage your teeth. Aquafresh uses sodium lauryl sulfate in aggressive concentration, specifically to create a foaming sensation that people associate with cleaning. But that foam is the damage happening. SLS is destroying mouth tissue, it's causing inflammation, it's causing canker sores. Aquafresh users report recurring canker sores that disappear immediately when they stop using the brand. The canker sores weren't a mouth problem, they were caused by Aquafresh. Aquafresh also contains fluoride in high concentration combined with SLS. This is a dangerous combination because SLS increases fluoride penetration into mouth cells. You're absorbing more fluoride because Aquafresh deliberately combines SLS with fluoride to increase absorption. It's an intentional formula for maximum toxin absorption. Aquafresh is specifically targeted at children, with colorful triple-color packaging and marketing that appeals to children. This is predatory. You're exposing children to aggressive SLS and excessive fluoride. Children have developing brains. Excessive fluoride affects neurological development. SLS damages developing mouth tissue. You're poisoning your children with Aquafresh while thinking you're protecting their teeth. Avoid completely Arm & Hammer. Arm & Hammer is marketed as natural, with packaging that emphasizes baking soda. Natural logo, but Arm & Hammer is a complete natural fraud. The brand contains many of the same harmful chemicals as other brands, SLS fluoride, artificial flavorings, but adds abrasive baking soda. Arm & Hammer contains sodium lauryl sulfate and high abrasivity silica that literally scrapes the enamel off your teeth. The baking soda seems natural, and technically it is, but when used in toothpaste in the concentration that Arm & Hammer uses, it's extremely abrasive. Arm & Hammer users report visible enamel wear within weeks, increased sensitivity, teeth becoming progressively more yellow because the enamel is disappearing. Arm & Hammer also uses fluoride in a concentration that, when combined with high abrasives, causes greater fluoride penetration. You're literally scraping the enamel, removing the protective barrier, while forcing fluoride to enter your teeth. It's the worst possible formula. Dentists specifically warn against Arm & Hammer because it damages teeth permanently. Arm & Hammer's marketing focuses on the word baking soda and natural to distract from the fact that the toothpaste damages teeth. You think you're choosing something better, something natural, when actually you're choosing toothpaste that damages teeth more than brands that don't use such high abrasives. It's marketing deception. Avoid completely Orajel. Orajel is marketed specifically for children as the brand #1 recommended by pediatricians. Child-friendly packaging. Bubblegum flavor. But Orajel is the most predatory brand on this list because it specifically targets children, the most vulnerable group. Orajel contains ingredients that are prohibited in many adult toothpastes. Orajel contains parabens, methylparaben and propylparaben, which are endocrine disruptors. Parabens are absorbed through mouth tissue in children. They accumulate in tissues. They interfere with hormonal development. They affect puberty. They affect reproductive development. You're putting endocrine disruptors in your child's mouth every day. Orajel knows this. The brand has internal studies, but continues using parabens because it's cheap. Orajel also contains propylene glycol, an industrial chemical and artificial saccharin. Propylene glycol is absorbed through mouth tissue. It accumulates in the body. It can damage kidneys and liver with chronic exposure. You're literally poisoning children with Orajel. The brand claims to be safe to swallow, as if this were an argument for it, when actually it means it contains ingredients that cause damage when ingested. Orajel also contains fluoride, often in high concentration for the children's market, because the belief is that the more fluoride, the better the protection. This is a lie. Excessive fluoride causes dental fluorosis in children, permanent white spots on teeth. It causes damage to developing neurology. Children using Orajel regularly have increased risk of developmental problems. It's a criminal brand. Avoid completely safe alternatives that actually work. If you're using any of these 6 brands, you need to understand what's happening. You're not buying dental protection. You're buying chemical poisoning with pretty marketing. Your teeth are progressively getting worse. Your fluoride is accumulating in your body. Your enamel is being eroded. Your gums are inflamed. The solution? Toothpastes without fluoride or with minimal. Fluoride from brands that actually care about oral health. Look for toothpastes with simple ingredient lists. No sodium lauryl sulfate, no parabens, no excessive fluoride. Brands like Hydroxyapatite, Boca, Dr. Bronner's and Tom's of Maine offer clean formulas. Coconut oil that has real antimicrobial properties. Mineral ingredients that strengthen enamel naturally. Plant ingredients that respect mouth tissue. Recovery takes time. Expect 2 to 3 weeks for SLS to be eliminated from your mouth and inflammation to decrease. Your teeth have enamel that is irreversible once damaged. Your gums have tissue that regenerates slowly. Your mouth has beneficial microbiome that toxic brands destroy. When you use these 6 destructive brands, you're destroying all of this. When you switch to safe toothpaste, you're restoring what was damaged. This takes patience because the damage is severe. The American toothpaste market is broken. This is a reality documented by Harvard, by toxicological studies, by laboratory analyses. Be vigilant. Choose consciously. Because when you buy toothpaste at the supermarket, you're making a choice between oral and body health versus slow poisoning. These 6 brands represent poisoning. They're profitable because they create problems that make you dependent on buying more products. Break the cycle. Your teeth and your body are worth it. Subscribe for alerts about oral health product quality. Enable notifications for updates about brands that fail safety standards before you buy. Share this with friends and family who brush their teeth daily. Information can be the difference between having healthy teeth or teeth that are progressively damaged. Your choice at the supermarket affects your oral health for years. The American toothpaste market is broken. This is a documented reality. Be vigilant. Choose products that respect your teeth. Because when you brush your teeth every day, you're either restoring your oral health or destroying it. There's no middle ground. The market is changing. Be part of the solution, not part of the problem.